Hello, I'm Dr. Boone. As we age, maintaining muscle strength and joint flexibility is essential to preserve independence and quality of life. Today, let's focus on gentle, low-impact exercises designed specifically for seniors. Start with a brief warm-up. March in place for 2 minutes, gently lifting your knees and swinging your arms. This increases circulation and prepares your joints. Next, chair squats. Stand in front of a sturdy chair, feet shoulder-width apart. Slowly bend your knees and lower toward the chair as if you're about to sit. Then engage your glutes and thighs to stand back up. Aim for 2 sets of 10, resting as needed. This builds leg strength crucial for walking and climbing stairs. Follow with seated leg extensions. While seated, extend one leg until it's straight. Hold for 3 seconds, then lower it slowly. Do 10 repetitions per leg. This targets your quadriceps without stressing your hips. Now try wall push-ups. Face a wall, place your hands at shoulder height, step back until your body forms a straight line, and perform 10 slow push-ups. This strengthens chest and arm muscles while reducing pressure on the wrists and shoulders. Finish with gentle stretches. Clasp hands behind your back and lift slightly to open the chest. Hold 20 seconds. Then, standing or seated, reach one arm overhead and lean to the opposite side to stretch the side body. Switch sides. Incorporate this routine 3 times weekly. Consistency helps maintain muscle mass, enhances balance, and lowers the risk of falls. Disclaimer: always consult your healthcare provider before starting any new exercise or supplement regimen to ensure it's safe for your individual health needs. Now, let's turn our attention to balanced nutrition, which provides the building blocks your body needs to stay strong and healthy. As we age, protein requirements increase to help preserve muscle mass. Aim for at least 1.0 to 1.2 grams of protein per kilogram of body weight daily. This could be a 3-ounce serving of grilled salmon, a cup of Greek yogurt, or a half cup of cooked lentils at each meal. Including a high-quality protein source at breakfast, lunch, and dinner supports muscle repair and bone health. Fiber plays a crucial role in digestive health and blood sugar regulation. Seniors should strive for 25 to 30 grams of fiber per day from whole grains like oatmeal or quinoa, colorful vegetables such as leafy greens and bell peppers, and fruits like berries and pears. Fiber slows glucose absorption, helping to keep energy levels steady and reducing the risk of type 2 diabetes. Limit sodium to under 1,500 milligrams per day to manage blood pressure, and avoid added sugars and highly processed foods that offer little nutritional benefit. Instead, build your plate around whole foods, half vegetables and fruits, a quarter lean protein, and a quarter whole grains. This Mediterranean-style approach has been shown to reduce cardiovascular risk and support healthy aging. Disclaimer: always consult your healthcare provider before making significant dietary changes or starting any new supplements to ensure they're appropriate for your individual health needs. Healthy fats are essential for brain function and cardiovascular health. Incorporate sources of omega-3 fatty acids, such as flax seeds, walnuts, and fatty fish like mackerel, at least twice a week. Monounsaturated fats from olive oil, avocados, and nuts support healthy cholesterol levels and reduce inflammation. Micronutrients deserve special attention. Seniors often need extra calcium and vitamin D to maintain bone density. Aim for 1,200 milligrams of calcium from low-fat dairy or fortified plant milks, and consider 800 to 1,000 IU of vitamin D daily, especially in months with limited sun exposure. Vitamin B12 absorption can decline with age, so include fortified cereals or a supplement if blood levels are low. Proper hydration isn't just about quenching thirst. It supports digestion, circulation, joint lubrication, and even temperature regulation. Yet many seniors unknowingly drink too little. Let's cover how to hydrate smartly. Start your day with a glass of water, ideally 8 to 12 ounces, to kickstart digestion and metabolism. Throughout the day, aim for a total of 1.5 to 2 liters, about 6 to 8 cups, adjusting upward if you're active or the weather is hot. Carry a reusable water bottle with measurement markers to track intake easily. Beyond plain water, include electrolyte-rich fluids when appropriate. A small glass of low-sodium vegetable juice or a homemade infusion, water steeped with cucumber slices, lemon, and fresh mint, can restore sodium, potassium, and magnesium without excess sugar. Coconut water, unsweetened, is another natural option, offering potassium comparable to a banana. Watch out for diuretic beverages like coffee and tea. While 1 cup of green or black tea can count toward your fluid goal, limit caffeinated drinks to 2 servings daily and balance each with an extra glass of water. Alcoholic beverages should be avoided or strictly limited, as they promote fluid loss and interfere with sleep quality. Use simple reminders. Set a timer on your phone every hour, or pair drinking with a routine activity. Take a sip after each bathroom break or before every meal. If swallowing large volumes is challenging, try smaller sips more frequently, or ice chips and flavored sparkling water to make hydration more appealing. Signs of mild dehydration include dark urine, dry mouth, fatigue, and headaches. If you notice these, increase fluids gradually and evaluate medications with your doctor. Some blood pressure or diuretic medications can increase fluid needs. Strong bones are the foundation of mobility and independence, especially for seniors at increased risk of osteoporosis and fractures. Let's discuss evidence-based strategies to maintain bone density with calcium and vitamin D. First, calcium. Adults over 50 require about 1,200 milligrams daily. Prioritize dietary sources before supplements. Excellent options include 3 servings of low-fat dairy per day, such as milk, yogurt, or cheese, which each provide roughly 300 milligrams of calcium. For those who are lactose intolerant or follow a plant-based diet, fortified almond or soy milk supplies 300 milligrams per cup. Dark leafy greens like kale, bok choy, and collard greens offer bioavailable calcium. A cooked cup can yield 100 to 200 milligrams. Be mindful of interactions. High doses of calcium supplements, over 500 milligrams at once, may reduce absorption and increase risk of kidney stones. If you need a supplement, split it into 2 500 milligram doses with meals. Check vitamin D levels with your doctor to tailor your dosage safely. Excessive vitamin D, over 4,000 IU daily, can lead to hypercalcemia. Vitamin D enhances calcium absorption and promotes bone remodeling. Seniors typically need 800 to 1,000 IU daily. Safe sun exposure, about 10 to 15 minutes on arms and legs, 2 or 3 times per week, generates up to 1,000 IU in fair-skinned individuals. Darker skin may require longer. In regions or seasons with limited sunlight, consider supplements of 800 IU daily to maintain blood levels above 30 nanograms per milliliter, which is associated with lower fracture risk. Combine calcium and vitamin D intake with weight-bearing activity, as mechanical stress stimulates bone formation. Activities such as walking, light jogging, or stair-stepping for 20 to 30 minutes most days of the week can slow bone loss. Avoid long periods of inactivity. Falls are a leading cause of injury in seniors, but many can be prevented through simple adjustments and strength training. Let's explore practical home modifications and body strategies to reduce your risk. Begin with a home safety check. Remove loose rugs and secure electrical cords out of walking paths. Install grab bars in key areas, next to the toilet, inside the shower, and along staircases. Ensure all stairways and hallways are well lit. Consider motion sensor lights for nighttime trips. Non-slip mats in bathtubs and shower stalls further decrease slipping hazards. Footwear matters. Choose shoes with non-skid soles, a low heel, no more than 1 inch, and good mid-foot support. Avoid walking in socks or slippers on smooth floors. Body strategies reinforce safety. Practice ankle and hip strengthening exercises such as heel raises and side leg lifts 2 to 3 times weekly. These improve balance and stability. Incorporate balance drills. Stand next to a chair, lift 1 foot off the floor for 10 seconds, then switch sides. Over time, progress to closing your eyes or standing on a foam pad to challenge your proprioception. Don't neglect vision and medication reviews. Annual eye exams detect changes that affect depth perception. Ask your physician or pharmacist to evaluate your medications. Some antihypertensives, sedatives, and diuretics can increase dizziness and fall risk. A healthy mind is just as important as a strong body, especially for seniors facing life changes such as retirement, loss of loved ones, or health challenges. Let's explore evidence-based strategies to support mental well-being. Begin with social engagement. Regular interaction with friends, family, or community groups lowers the risk of depression and cognitive decline. Schedule weekly phone calls or meetups. Consider joining a book club, volunteer group, or senior center activity to foster connection and purpose. Next, challenge your brain. Cognitive exercises such as crossword puzzles, Sudoku, or learning a new skill, like painting or a musical instrument, stimulate neural pathways. Aim for at least 15 to 20 minutes daily. Even simple activities like juggling scarves or assembling a jigsaw puzzle boost memory and attention. Stress management is crucial. Practice deep breathing exercises. Inhale slowly for a count of 4. Hold for 4, then exhale for 4. Repeating for 5 minutes. Mindfulness meditation, focusing on the present moment without judgment, can reduce anxiety and improve mood. Begin with short sessions of 5 minutes, gradually increasing as you become more comfortable. Prioritize sleep hygiene. Aim for 7 to 8 hours of uninterrupted sleep. Establish a consistent bedtime routine. Dim lights an hour before bed. Avoid screens, and consider reading or listening to calming music. Keep your bedroom cool, around 65 to 68 degrees Fahrenheit, and quiet. Earplugs or a white noise machine may help if needed. Finally, if feelings of sadness, hopelessness, or anxiety persist, seek professional support. Counseling, support groups, or even medication under a physician's guidance can be life-changing. Mental health is just as medical as any physical ailment. Staying proactive about your health means more than just eating well and exercising. It also involves regular checkups and screenings. These tools detect problems early, often before symptoms appear, when treatment is most effective. Let's explore the essential screenings seniors should prioritize. First, blood pressure. High blood pressure often shows no symptoms, but increases the risk of stroke, heart attack, and kidney damage. Seniors should have it checked at every doctor visit, or at least once a year. If you monitor at home, keep a log and share it with your healthcare provider. Cholesterol levels should be tested every 4 to 6 years, or more frequently if you have diabetes, heart disease, or a family history of cardiovascular conditions. A standard lipid panel will measure LDL, bad cholesterol, HDL, good cholesterol, and triglycerides. Don't forget vaccinations. Seniors need annual flu shots, a tetanus booster every 10 years, the shingles vaccine starting at 50, and pneumonia vaccines starting at 65. These are crucial for protecting aging immune systems. Blood sugar testing is vital, especially after age 60. A fasting glucose test or A1C test can identify prediabetes or type 2 diabetes. Early detection allows lifestyle changes to reduce complications like nerve damage or vision loss. Bone density scans, DEXA scans, are recommended for all women over 65 and men over 70, or earlier if there are risk factors. Osteoporosis is a silent disease. By the time a fracture occurs, the risk factors are significant. Significant bone loss may already exist. Colon cancer screening is advised up to age 75, using a colonoscopy every 10 years or stool-based tests annually or every 3 years, depending on the method. For some people, screening may continue beyond 75 based on overall health. Vision and hearing exams should be done annually. Poor eyesight or hearing isn't just frustrating. It increases fall risk, social isolation, and cognitive decline. Corrective lenses or hearing aids can dramatically improve quality of life. I'm Dr. Boone, and thank you for joining me on this essential journey through senior health. As we've seen, healthy aging is not about perfection. It's about consistency, awareness, and small, sustainable changes. You don't need to overhaul your life overnight. Instead, start with 1 or 2 areas. Maybe add a glass of water in the morning, take a short daily walk, or schedule that long-overdue checkup. These simple choices form the foundation of strength, balance, and peace in your later years. Remember, your health is your independence. It's your energy to enjoy your grandchildren, your stability to explore the garden, your clarity to read a book, laugh with friends, and sleep peacefully at night. No matter your age or background, it's never too late to take steps that nourish your body, strengthen your bones, calm your mind, and protect your future. You are worth the care. Disclaimer: always consult your healthcare provider before beginning any new exercise program, supplement, or dietary change. Every individual is different, and your doctor can guide you based on your personal health needs.